this is to, we just want to find out where council can help in attaining more services or better services, whatever what you feel is needed. I know I talked to Rose a little bit about travel and stuff like that. We'd like to just mull it over and just see where we can help a little bit. I know nursing is another issue that's getting worse and worse. So we'd like to get your point of view and just where we can get together with Northern Health and help a little bit. So this is kind of, you're just getting back yesterday, so
yeah. So you'd like me to answer that?
Yeah.
I'll try. I'm not sure how much sense I'm going to talk, being A, jet lagged, and B, just having got back. So, but I'll do my best. I had a quick chat with Dr. Solomon and Dr. Pillay this morning and the office staff. So I've got a very quick summary of what's happening. So I can try. And just to clarify as well, I'm no longer working at the clinic. So the clinic is a private institution, managed and run by the physicians. That's the Tumbler Ridge Medical Clinic, but I'm still the chief of staff for the health centre. So when it comes to working with Northern Health from your perspective, or when it comes to issues that involve the health centre as opposed to the medical clinic, I'm still the person to be going through, because I'm the chief of medical staff, so I'm still dealing with the medical politics and so on. So I can certainly try and help you with anything like this. I'm not going to be in that position forever. I'm trying to help with the kind of a smooth transition. But for the moment, it's still me. So, yeah, I've been away for just over 2 months, and I just got a summary this morning. And from what I'm hearing, there are a lot of things that concern me. There are many ways to look at it, one of which is to say that for the past 25 years and more, we had Barb and Gail and myself and Beryl, in 4 different departments, but with that consistency over time. And Beryl is off sick, Gail has retired. I'm in the process of retiring. I don't know quite where Barb is, but she's still there. But she's obviously, facing quite significant challenges because of staffing and so on. So it's certainly a time of flux and challenges. I'm hearing that there are significant nursing shortages. So the only way that the place currently is staffed with nurses is through agency nurses, in addition to Barb, but Barb is largely in admin. And it gives, an agency nurse gives you a nurse, but it's, in the olden days, we used to have, Ruth and Jessica, and all these people that the community knew these people over a long period of time. So when you came to see them, it was like coming, even though you were sick, it's like you were with a friend. And that, I actually used to boast that this was like the finest place in the world for medical care, and the service that was delivered was the best in the world. You couldn't equal it. And there were certain things we didn't have. We all recognized that. We more than made up for that in the personalized care and so on. So it's just, with the best of intentions, I don't see how an agency nurse can actually duplicate that. They're here for a few weeks and then they're gone. They can do a great job, but it's not quite the same. So we've got issues in Emerge. My understanding now is that mental health is not operating. There's nobody in mental health. So I just asked Dr. Pillay and Dr. Solomon this morning, so what are you doing? You've got someone in a mental health crisis or just needs a bit of counselling. What are you doing? They looked at me, what can we do? Send them to Dawson Creek. Whatever, so that's the challenge. I think only now are people realizing what kind of a service Beryl gave over 25 years on her own. Virtually 24/7 X-ray and lab coverage, non-stop, even when she was on her own. At times she had help, but largely on her own. And since she got sick, and there have been these replacements, and currently there are 2 people that are working there, but I can't tell you how difficult it is as a physician if you haven't got the basics to work with. So you haven't got X-ray and you haven't got lab. And my concern, and I can express this honestly now because I've got I'm out of it now, but my concern is that we're actually putting our physicians at risk because you haven't got, it's within Canada, I mean, it's a first world country. You're supposed to have the basics. You can't have CT scanners in Tumbler Ridge, but you should have X-ray and lab. And we got used to those things being there non-stop. Whenever you need them, you call them and they come. And even now, my understanding is there are times when there's no X-ray and there's no lab and person, but my understanding is not a continuous service now, and sometimes you'll need something and you can't get the service and so on. And in the interim, when Beryl took ill, and before we got these current folks, I mean, there was sometimes a week and more when there was just no X-ray and lab. And then Northern Health would try and fill the position. And Northern Health will always try and do their best. And they've got a very, very difficult job to try and, I don't want to be Kendra Kiss. I think she's got huge challenges. I'm sure she does her best. I wouldn't want to be in her shoes. And so, to go for a week without X-ray and lab, I think it actually, it's just waiting for the tragedy to happen. And then the defense of the physicians can be, well, we didn't have X-ray and lab. The public opinion is going to be, you guys screwed up. This person's dead and they shouldn't be dead or whatever. So my concern is that we're putting people at risk through this. And my understanding at a different level is that the building is falling apart and is leaking, and there's structural issues as well. So one of the few positive things to report is that the doctor's office is apparently doing very well. And we've got Dr. Solomon. So the way we, there's always been a challenge in attracting physicians to small communities in Canada. And there's a program, like a fast track for foreign doctors from certain countries. And we've made use of that program to attract firstly Dr. Solomon here, and then I'm going to call him Dr. Ife because he's got a long name, but everyone calls him Dr. Ife, and you've met him, Your Worship. So he's joining us in March. And Dr. Pillay is here, so we're actually going to have 3 physicians. So doctor's office, there's not a problem. There's no issue there, but the issues are in everything else. It seems to be where the problems lie. And about 8 or 10 years ago, I was concerned then. And I mean, you compare what we got now with what we had then. And you look back 10 years ago, it was like luxury. We had just about everything we needed. At that point, I was comparing it to what we'd had 10 years before that, because I could see the trend. It's getting, every year we're losing something. We're losing ground, we're losing ground, we're losing ground. It's getting worse. So actually, and at that stage, we had the mayor's task force on seniors' needs as well, that I was a member of that committee for 3-4 years or whatever. But anyway, I worked with Dave Price and with Greg Halseth, Professor Halseth from UNBC. And we actually did research comparing communities, and we published this research in the Journal of the Society of Rural Physicians of Canada. So this is published research, which is now a document which can be cited and referenced by anybody. And it essentially compared communities to see, is everybody in the same boat losing ground, or within rural BC, do we have some communities which are hanging on and others which are losing ground? And it seemed to be that even at that stage, Tumbler Ridge was losing ground more than other communities. So I'm actually tempted. I've got to think, how can I respond to this? what can I do to try and help the community when things have reached this stage? And the one thing that I can try and do is to do further research and to publish again as a researcher and as a scientist, working again with UNBC. That's just an idea which I've just been thinking about for the last few days, but it's citizens complaining, or it's a different level when you've got a scientific research which you can cite and you say, here's the evidence. It's not, he said, she said, or whatever. Here's what's actually happening. So I'm thinking about talking to Greg Halseth and saying, Greg, it really is time for a follow-up. How do we try and structure this? And then I guess the other thing, Rose is here, and my impression of TR Cares is this absolutely heroic group that I can't believe what they actually do with little resources and the kind of service that they provide to our residents. And the problem is, as I see it, they've got their contracts and their requirements that they have to meet, and they would like to do more, but they're also stuck with they've only got so many volunteers or whatever. And then we get, I think, residents not completely understanding what the situation is with TR Cares, and then you actually get people complaining. And I know if you're a volunteer, the worst thing that you can have is, my motto is never criticize a volunteer, be grateful for what you've got. But now we have complaints coming in. And I think it's just a lack of understanding. You always understand where a person's coming from. People are suffering, they've got serious diseases, they need to be somewhere else, and we don't have a bus service. So I just feel, and I haven't spoken to you since I got back.
And I want to speak to that when you're finished.
Yeah, no, when we spoke before I left,
yes.
I just try to give you
that's magnified,
all the support,
Charles.
all the support that I possibly could, because you guys are doing your best to provide a service under very difficult circumstances. And I just take my hat off to you guys, and I get kind of annoyed when I see people criticize and not appreciate it. Anyway, that's a summary for me. Thank you.
Go ahead.
So, Mr. What can we do? So, I know we have 2 apartments, and I'm not sure how much they get used. The district owns 2 apartments, but even helping try and attract the lab, the X-ray, more nurses, drug and alcohol counseling. I mean, it's not, and then there's youth counselors. That's what we're kind of looking for. What can we do as counseling? Do we need to, that's why we wanted to have this meeting before the budget, so that we can actually try to look at adding stuff to the budget to try to help out that facility. So we have that stuff for our residents. Mm-hmm. Right? And I know there's lots of people in TR Cares are going to hit the same thing, because I know it's volunteers that drive, but maybe we need to up their in kind and stuff like that we gave her a fee for service, so they can start paying drivers, so that we can get people to dialysis and not just use the mandate of Northern Health. If there's something else we can do there. So that's kind of what I would like to know, is there, how do we help attract that lab and X-ray? Burrow's amazing, we all know that. Working with BCM, it should come at 2 in the morning, and be there all morning. So, and same with doctors. So that's kind of what I'm looking at. What can we do, money-wise, apartment-wise, anything?
Yeah, and I think it's great actually having yourself here, having worked in that facility for so many years. I mean, you know what we're up against there, and you also know, when push comes to shove, what you need to get the basics done, and the basics involves lab and X-ray. It's just, there were actually times when it was virtually embarrassing, because I had to work under that scenario for a while, where you phone Dawson Creek and they say, sorry, I've got to apologize to you, we just got to send this guy as is, because we can't do anything. It's the pits. But I've actually come to council, not your council, I've come to previous councils in the past on a number of occasions and asked for this kind of help, and it was not forthcoming. And then I had a couple of good chats with your worship a few months, about a year ago, a few months ago, about how to try and make things different. So I think this is fantastic, that the initiative has actually come from this council. I think it's really good. So what I can say to you is, one way to answer that question is to look at what other communities do, and what has worked and what hasn't worked. So other communities, as far as I know, it's largely physician recruitment that they're involved in, and here we don't have. That's the one thing we don't have a problem with. But the councillors actually go to conferences, and the councillors go to these things where you've got all the grads, and it's like fairs for where the grad's going to go. There was one story I can tell you about Laurie Ackerman when she's still the mayor, I'm not sure, but she was the mayor of Fort St. John, and she was out there at one of these medical conferences with a booth trying to attract graduating physicians to Fort St. John, and she gave them a whole spiel and everything. This young lady then says, yeah, and it's very good that you're in favor of this, but I wonder what your mayor and council think about it. And she said, well, I'm the mayor. That doc is in Fort St. John right now. That was just a little story, but it gives you an idea of what these people actually do. So I think you could, in theory, target, okay, where are the problems? Mental health, lab and x-ray, nursing. And in theory, you could actually get some basic information or training or whatever for councillors or the mayor, whatever, and actually attend these things. And then it's an issue of how do you sweeten the pot. Money is obviously one thing. Accommodation is certainly one thing. Relocation expenses. So the downside in that is when you've got people that have been here forever and receive no incentives whatsoever. Now suddenly you bring someone new with all these incentives, then you get jealousy and envy, and one has to recognize that. So that's a downside of this. But at the same time,
just on that, I don't think it's a downside, because I think there's something we can offer, like a Barb and like a Jess that used to be here. I think there's something there we can, I mean, I'm not gonna say sweeten their pot, but I think you hit it right there when you go and offer a nurse 20 grand, a new car or a new house or a apartment for free. I think you have to look at doing something for the people that are already here, absolutely. And that's what I'm in favor of. It's all about getting the healthcare facility. I wasn't probably here when you talk about the 10 years before you started thinking about this. I wasn't here, but I mean, I heard how Tumble Ridge had everything. Chiropractors, massage therapists, right? That's important.
And we used to have physiotherapy.
Yeah.
But so the two ways are, number one, attending these fairs. Number two, finding ways to sweeten the pot, whether that is through a cash incentive or accommodation incentive. I mean, it's basically a cash incentive, accommodation, and relocation. Those are the three areas where you can offer financial support. And then the other one is just, and I've spoken at length with Mary McPherson about this, and just for example, when Dr. Iffy, when we heard that he was a possible candidate here, then I came to you and we said, how do we, just sell Tumble Ridge to this person? And I think we did a very good job. I mean, he was just blown away by the visit and by the place, and we actually went to your ranch and showed him all sorts of things, and so he's coming in March. And so I think it just requires a kind of a good communication between the health center and the town hall, and that if one knows anyone is coming, let's just say there's a nurse that's even thinking about it, she shouldn't just come to the health center and meet the health center staff in Northern Health. She should actually meet the mayor and council or a representative from mayor and council, and just, that's what other communities do. I know Mayor Bumstead in Dawson Creek, he's big on this. He's taking people out for lunch all the time. And so I think the way we try to address that with Dr. Iffy, we do that. And then the final thing, obviously, if there are significant concerns from mayor and council, is for you to talk to Northern Health.
We're going to be on that.
And, as chief of staff, I go to NEMAC meetings, and I need to report on the state of what's going on in Tumble Ridge. So from my side, from what I've heard now, at the next NEMAC meeting, I'm going to be saying what's top of mind for me. These are worries, and what are the plans to fix it, whether it's structural or staffing or whatever. But for some reason, the track record, we had the seniors task force, the mayor's task force on seniors needs. For some reason, the communication between district and Northern Health was fraught with, it wasn't good. There was a lot of animosity, and discussions were not held in a kind of a constructive way. And I'm hoping everyone's beyond that. because it needs to be constructive and it needs to be simply, we're losing ground. And the other question to ask is, if the trend continues of losing ground, where are we going to be in 6 months or 12 months? And the answer is this could be a nursing station.
What worries me is that, yeah, we got the 3 doctors, but in the discussions we had at supper there, the concerns were that if you don't have, like you stated, if you don't have the lab and all that working, they can't do their job. And then, so you throw in that part of it, then you throw in the building falling apart, and you throw in the lack of nursing. It makes it tough for a doctor to say this is a place he wants to stay. And I really worry about that.
What you've got right now is with this program that they come in on, they actually have a 3-year contract. So they signed up for 3 years. Dr. Solomon has sort of done, I don't know, about 8 months or so. So he's towards the end of his first year. Dr. Iffy will have a 3-year contract. It doesn't mean that he has to do the 3-year contract in Tumbler Ridge. It has to be, ideally he does. But let's just say we had one of these folks, I can't work like this, I need this and this and that, it's putting me at risk, however you want to phrase it. Yeah. They could ask for a transfer. So it's looking good right now, but that could turn on a dime.
The other thing was, when we talk about housing and that, like Northern House seems to be we've really let them know that we've had the condos and that. They seem to be really happy, and I think they are using them. That's what I was told anyway, that they have been used. So, I don't know if we have to build on that, or do we need more, or do we have enough?
So, right now it's not the staff, the apartment things. Are they fully used all the time? Do we need more?
I'm not sure. I'd have to check into it and see what the
curious if there's a shortage
stats are on that.
of.
Yeah.
But I know that, I think that we're one of the few communities that offer that already, because I know Dawson Creek is looking into doing that.
Yeah.
But they don't have it right now.
Yeah. And just the other things are sort of occurring to me as I'm speaking here, but when you're trying to recruit, if you can involve the spouse or partner, it's huge.
Yeah.
It's often, couples, one might want to come here, but what's the other one going to do, etc. If you can just find out, so you've got to be a kind of a detective ahead of time. You've got to get the dirt on these people. What are they like? What does the spouse do? Do they have kids? What are the kids into? And then you just hit them with all this. You've thought through, here's what we can offer you. Here's, so your kid likes this. Here's what we have for them. That's what other communities do this. So it's a competitive game. And if you don't do this, you're actually kind of behind anyway.
Well, I brought that up because that came up at one of those suppers there, and I brought it up at council and with staff about finding or creating a spot for one of the wives, and it was all, I kind of was looked at it a little funny, I think, but it is something that other people are doing, so we got to get into that game if we want to attract these people. So it's something we got to keep thinking about. Did you have your hand up?
I did. Biting my tongue just a minute. I got to restructure my thought. The new board that's just been formed in Dawson Creek there for the South Peace Health. I don't know if you get forwarded the information. I didn't actually make the first meeting, but reading the bylaws, looking at all it's standing for, looking what it is, it's what we're already been doing. I'm not sure how much involvement with that Tumbler Ridge will have an influence over. I'm hoping to get to the next meeting, but it's what we're talking about right now is basically what they're doing. Having said that, the big pot of their money that they're looking for is to attract to the South Peace, the doctors and all those other things that we're doing, like the monies and talking about all those things and ways in which we could redirect funds through municipal donations to perhaps other organizations such as that one or local organizations, so that municipalities or cities are not contrary to what the charter allows or doesn't allow, relevant to assisting business and doing the provincial government's job. So part of the construction of the off conversations that I've been having is how to create that environment so that we can do all these things and still be within the appropriate boundaries, if that makes sense to you or not. You hear what I'm saying? So they are on top of that, what we've been on top of, I think, for the last 20 years. And some of the topics that Charles brought up there, like the mayor's task force, that goes back to when Mr. Casely was mayor and he created the mayor's task force. We'd had an existing organization under that before with Truck, Tumbler Ridge Umbrella Committee. That's grossly missing in our community, and at times we've approached people about reactivating Truck, which is a great arm's length from being too involved on a hands-on level. Do we do, like, for example, do you challenge council with the choice, do they fund a nurse, or do they fund an x-ray lab, or do they fund here, or do they fund there, and where does it end once you start that pattern? So I think the getting the task force up and running again for me, would be a really good thing. Or Truck, Tumbler Ridge Umbrella, I still have all of the documentation for it. It's ad hoc, so it never folds, right? Part of what Charles has identified with the loss of, and I'm going to go back over the last 12 months, and that includes the loss of Charles in my world, and Gail, and Burl, and Jessica, and Lindsay, and all of the nurses, and Jessica over in mental health, and Autumn. And for an example of the structural changes that are taking place within our community, my day job of outreach and Safe Home and my partner in Stopping the Violence Counseling and Children of Witness are now occupying the public health office. The public health has been reduced to 1 day a week up in a little office that used to be Barb's. That's where they are now. And home care 2 days, I think, is in the little where the dentist used to be. So that tells you how much things have changed. Mental health in its entirety is empty. There's nobody in there. Barb will be moving over to our old offices. So when we got there, there wasn't a space, an inch of space that you could put another person in, including the dental and everything else. So what's happening for us on 2 levels. On Monday of last week, we documented, Debbie and I, on Monday and Tuesday, we had 17 calls that were not related to our programs, but to mental health, addictions, stress, things that we are not capable or credentialed to take in to our mandate. So you do the best you can to redirect them to telephone numbers, to crisis lines, and that's what we are doing. But it shows a demand on us as well. The residual also for TR Cares, as we've indicated, and I've talked to council about what our contracts are, and for an example, the yearly contract is 40 trips a year to Dawson Creek. On September 30th, we were at 45. That's April to September. So that tells you how much we are doing. The increase came with a lot of extra lab work, because you've got cancer patients who can't wait, you've got infections, you've got things that couldn't wait, even including having the lab here right now. We have had to make, I can give you an example of a female on the chamber who went back 4 days in a row and finally went to Dawson to get a blood test. And we had lab, but they weren't there, they didn't show up, they changed their schedule, things are happening. So with that comes an increased request and demand for TR Cares. So there are several issues where that's happening in lab, in x-ray, in everything, in our aging population that, Don, you'll remember we talked about a lot in 2003 when the seniors came to our community, when we sold our town, and they were 55, 60 then. They're 75, 80 now. And we've got a huge senior problem of, I'm going to call it neglect, because they're alone. They're often deceased for days before somebody finds them. They're sick, and there's no family. So that's an additional issue that I think is what's the word, I don't know. It is particular to Tumbler Ridge because we brought so many in at once without family support. Where other communities like Dawson have a 100-year history of family in the area where we don't. So that's huge on our plate. And at the same time, our home support has been cut from 5 employees when I got here to 1, 2 days a week. So we've got huge problems. We've got huge health problems within our community. I received a call from Mike Bernier last week, who received a call from the health minister who had a complaint about TR Cares, the provincial health minister. Went to Mr. Bernier, who went to TR Cares, and he might have used the F word, like as in fun, but is going on out there. I know TR Cares, he's at all of our golf tournaments, he fundraises, he's a great supporter. So I sent him the contract, and when he stopped laughing, he said, okay. I said, we have people who are terminally ill, who require chemo 3 days a week. Can't afford to stay at a hotel if they can find one in Dawson Creek. And there's not just one family, these are multiple families, as you know, Charles. And they're alone. Many of them are alone, some of them might have families. We can't take them Monday, Tuesday, Wednesday, go to Dawson on Thursday. We have been doing that. We're timing out our kilometers on our vehicle in 1 year, that should take 3. So it's not just about money. It's not just about having more volunteers. It's about having a fixed program that we must stay inside, or else we become considered taxi service or bus service, and we don't want to go down that road. We can't charge money. We can't pay a driver because then they become an employee. Then they have to have these classifications, and we got to add $100,000 a year to our operation. We're not going to do that. We are burnt out a little bit. We are taking from the 13th to the 31st off because last year we had 1 client in that time frame, and 4 of us that are TR Cares people are leaving the community for a couple of weeks, and so are a few others. They're enjoying holidays as well. It does put a burden on some of our clients, I'm sure, but there comes a point in time where you just got to stop and regroup, or we'll have nothing by January. And that's not what we want to do. But all of these things that Charles has identified has led to us feeling like we are now having to choose. Do we take you for your chemo, or do we take you to your heart specialist that if you don't see that you've waited 7 months for, or maybe you need to go to that eye specialist, or you'll be blind because you need to have that surgery. So we as callers now have to go back to the basic and say, here it is. Thursday's Dawson Creek, once a month Fort St. John. We're going to add 1 extra day to Dawson Creek in January. I am working with Northern Health. Our contract is up in February. We didn't even use all the money until October that they gave us, plus we have the money that the grant that we get for operations, and we're good. We're good for money till March 31st. That is if the contract gets renewed. And they see no reason why not. They were not aware, nobody ever called Northern Health about us, but that's okay. The Minister of Health for the province knows, but Northern Health did not. So we are working with Northern Health to the issue. We can't solve it. What I am proposing that perhaps, Mayor, you could consider in talking to Dawson Creek is partnering on getting a house or even a hotel that we could secure. We can fundraise, we can find money in Dawson Creek, we can take cancer patients or other persons who require multiple treatments in Dawson, that we could take them in on Monday and pick them up on Thursday. And they could stay for $5 or $10 a day. I don't think anything should ever be free. There needs to be a few dollars for pride, if nothing else. And so then that would help alleviate us for these scenarios. Even for surgeries, people can arrange surgeries most often between Monday and Thursday. It's rare there's surgery on Friday. Going for colonoscopies, they have to be there at 7 in the morning. We can't take them. They need to go the day before. They can't afford a hotel. So another pot of TR Cares has been paying for that. So our as we always boasted proudly that we had got ahead where we were able to operate 11 months without help from anybody, that's not true anymore. Because we have 9 programs that we have to feed, and we're downsizing a few and redirecting to health. but that's where we stand at this point.
You know, I've talked to the nurses, the head nurse in Dawson Creek. She was at a regional district meeting. I've talked to Northern Health in regional district meetings, and I brought up a lot of our issues. When I talk about the renos, though, you know, there's things like I don't know what's wrong over there, so I'm just talking about the renos they talked about a few years ago that they shut down. So, but I can't. I heard the other day there was a smell in there that sounded
All for
like
months.
something had died or something. But
Well,
you
there
know,
was, though, in defense that day, there was a death, and it wasn't pleasant in the building, you can't help that.
yeah. But what I'm wondering is, do you think with all the issues that you both brought up, do you think a meeting with say the nurses, Northern Health, and yourselves, council, here in Tumber Ridge, and we could go over these things and see if we can come up with some solutions? Because I as has been said, I think we're ahead of the game a lot of because of Dr. Helmsworth than some of the communities, yet we're slipping behind, and there's things there that they all know. Like the other day there we were talking, well, on Friday, we were talking about Bruce Troopy's issues, and then all of a sudden it came up, well, Tumber Ridges are twice as bad, and they're talking about travel and all that. And that was Minister Minister Bernier, Emily Bernier, I guess it is now, and he's the health critic. But he let me know that. I didn't realize that. But yeah, and he's really interested in getting involved in this. And you know, I think if in the new year to have a meeting of everybody at the table, so that there's nobody there to say, well, we'll talk to them later.
Right.
Let them talk.
If I can, Don, like, we're the same but kind of different. I know from our end, what would really help us and save us time every single year, we go back and we do the same thing over and over and over again. We get a hold of the specialists, we talk to the hospitals, they schedule whoever is responsible for scheduling would really be great to be here, because that could help us alleviate some of the problems. If there is no x-ray and we need to get people out, we still need to get people out, we still need to get x-ray in, but it's both hats, don't you think?
Yeah, and just the other thing we haven't mentioned is, in the way olden days, the Bill Merson Quintet used to sponsor a fund, forgotten what it was called, but you used it to, if you had a really serious thing and you needed to go down to Vancouver.
It was a medical health fund.
Yeah,
I was
but it
on
had a
the
name,
board,
it had a
yeah.
name, but anyway.
Yeah.
So we have a track record of industry chipping in and saying, you know, health is important to our employees and our citizens, and therefore, you know, at the moment I'm not aware of anything like that, but it's just another avenue to look at. And so maybe you want to have, I think a meeting of the kind you're suggesting, Your Worship, is the way to start. But I'm just thinking maybe one should invite the main industry folks as well. I think the RLA should be invited to such a meeting. I'm not sure if we have any nurses to invite, but in principle, yes. So you have to start somewhere, and I think a formal meeting is probably a better way to start than just picking up a phone and calling Kendra.
Kendra, is that the nurse in?
Kendra Kiss,
Kendra
she's
Kiss
the
is the
regional manager for the South Piece
Yeah, of
Okay.
Northern Health.
of Northern Health. Yeah.
Oh, okay. Helen, you had something?
Yeah, I think everyone's aware of the problems, and it's not like Tumber Ridge, we are faced with the challenge of remoteness and attracting the right kind of professionals here. Do you have a list of the conferences and the fairs that we should be looking at? Like, if we could fine tune the ones that you think would be the most important to go to, like, you know, the graduates from UNBC.
So the only thing, if it was the medical folks, I would be able to give it to you right away, but it's not the doctors, it's the others. So
Yes.
you actually need to talk to the nurses and
Right.
you know, someone in mental health. So probably Barb would be the person to help us there,
Yeah,
because I have no
okay.
connection with that.
But I was, do you think attending like UNBC, or if we could put a little pamphlets together to send to the, you know, kids that are, or the adults that are graduating from nursing school, the specialists for lab and x-ray, and send those to be handed out, and then try recruiting.
Yeah, that's where one has to start.
Yeah.
The only problem is everyone else is doing it.
Yes.
So,
Right.
but you know,
UNBC, they don't have a nursing program yet?
no, but like Grand Prairie does.
Oh,
It's a Grand Prairie
Yeah.
as well.
Because I'm supposed to go to a meeting on Wednesday in Dawson Creek about a program for UNBC.
We can ask Barb to get those details, and I've got no idea where one would start with the mental health. But I mean, it's possible.
The other thing that crossed, I mean, we talk quite often about these issues, and I mean, when you can approach somebody with a potential solution rather than just a bitch, oh, pardon me, I mean a
yes.
complaint or a concern, and there are solutions, there's small solutions that don't necessarily seem like much, but when you put 3 or 4 of them together, it helps resolve a lot. The other question that used to come up, I remember in our day, back in the early 2000s and that, was under the Mines Act, there was a requirement of a certain level of medical attainment that had to be available within a certain radius. And I know Quintet and Bull Moose were both within our radius, and I mean, Walter or Kanuma is not that much distance. And I mean, if we had in my opinion, for being over there, and I'm sure Daryl you'd agree, we had a couple of the issues of the serious issues that were brought in here and taken out by STARS, and there was no x-ray and no lab, it would have been a whole different scenario in one case for sure. And it used to be a requirement, a certain level, and I don't know if that's still the case. It's something that maybe you could look into for a little bit of meat, to have a little bit of bartering tool for it, but it's not, on the other hand, on my other hat, I'm gonna use chamber, it is not easy to attract any new business with what we are losing more and more of. It's impossible. We wouldn't go to a community at our age with less than what we have here. Why would we want to bring why would they want to bring their families? We got to maintain that to be the #1 attractant for new
So
business.
The problem is, at the moment, you kind of got to be healthy to do well in Tumbleridge.
Correct.
And this is a very bad thing. So some of these folks that are laboring with these problems that Rose has mentioned, the best answer to give to them is, you shouldn't be here. What are you doing? Why don't you live? That's the best thing for you to do. And these people actually cannot live. It takes money to live. They need family to help. They haven't got these things. But that's, it sounds cruel to say that, but that's the best advice to give these people. You shouldn't be here. What are you doing here? And this is terrible, and because this is actually, Canada, by all the international measures, is one of the leading countries in the world. And you cannot, at some level, what frustrates me about it, at some level there has to be, this can happen in other parts of the world, but this cannot be allowed to happen in Canada.
And it is happening, right under our noses, so to speak. It was like a slow-eating cancer that just all of a sudden went to, took another step forward, and we've got to stop it, because it seems like since we only have one mine, or we're not making enough noise in there, they're just cutting us, because we are, and I hate the term, but I've heard it used at me by a medical person, the Grey Tsunami. Well, guess what? I'm one of them. And we have no he's way past that. But, okay, that was it.
Thank you.
You're welcome. But it's true. And I mean, the person we can use, and we can use very loudly, and she gladly gives us permission to do so, is Lucille Jacobson, who would have loved to stay in this community, but couldn't. Now, some of us are going to have to make the same choice. If it was me or Tim, right now, being faced with the same thing she had, we would have to sell our home and move. And I understand that, because Northern Health can't fix everybody's problem. But we have to do better than what we're doing now, or we've got people, I do tell people, you have to leave here. How can I help you make that happen? But when you've bought homes for $250,000 and you can't sell it for $170,000, they don't want to go, even if they're paid for, and I don't blame them. Who wants to leave Tumblr? It's perfect,
Yeah.
except,
It's the reverse of what it was.
correct. I mean, Mandy, my daughter, she can't leave. She's still got a $60,000 negative owing on her budget, so she doesn't want to. So we need to do something.
Councillor Kirby, you had something?
Oh, yeah, thanks, George. I think some of my questions have been answered, but,
Oh,
You know-
sorry. Scottish break time, my apologies. Tumblr and Jody.
we can address it, and this council is wanting to address all the needs when it comes down to health services in Tumblr. The building itself. So the medical clinic building is a Northern Health building?
The whole building is a Northern Health building, so the medical clinic rents space.
Right. So how do we, so that's an issue right there, is getting that, so that's something we take to Kendra Kiss on getting that, all the updates or any kind of work done?
It's not a little
Yeah, so
Band-Aid. It's going
it's-
to be a big thing, I think, to do the whole thing properly. But I mean, it's like lots of buildings in Tumblr Ridge are reaching
Yeah.
that edge.
Yeah.
And apparently there are, this has been said to me, I haven't seen it for myself, but I mean, there are buckets all over the place because of all the water that's coming through the roof. I don't know. Haven't seen it, but that's what I've been told. But there's just one other, if you're looking for solutions, I always ask what the role is of involving the community, involving the residents, and making them aware of, you know, where you as council stand on this. And I think there's always, you know, there's advantage to be gained from that, and the things that can go wrong as well. So I understand people are hesitant about telling the community how bad it is, but Councillor Krokaka, you might remember the very first time that we had no ambulance. I actually wrote a letter to the editor of Tumblr Ridge News, to the citizens of Tumblr Ridge, saying, you need to know that last weekend there was no ambulance if you needed it. And that was the first time that it happened. And then, you know, afterwards,
Yeah.
it just became the new norm. There's no ambulance, we've got to fix it. You know, and I mean, we haven't even spoken about ambulance today because I think it's a bit better now, actually. But, you know, we went through hell there. There was one cardiac arrest, phone 911. Yeah, we're going to send an ambulance right away. They'll leave Dawson Creek immediately. So Barb and I just ran over there with the defibrillator and did it. You know, we ran because there was no ambulance. Right?
I showed up in shorts and flip
Things like,
flops.
eh?
I showed up in shorts and flip flops.
Remember that?
Yes, I
Yeah.
remember
Yeah,
that.
yeah, exactly. So we then had another case like that, and even worse. The details don't matter. We had another case like that. Oh yeah, no, so I wrote this letter to the editor, and I asked citizens to do something, to write or whatever. But one person that actually responded, and that was Lucille Jacobson.
I was gonna say it was Lucille.
That was Lucille, but you know, I was just amazed at that time. You know, the complacency of people. People will fix it. Northern Health will fix it. The doctors will fix it. The docs are still there. Everything's fine. You know, and I was kind of disappointed that more people didn't take this seriously. And you know, how you actually get the community motivated. Other parts of BC, it happens. In Princeton, the same thing happened. The community response was enormous. They were up in arms and they put pressure on government and they won. Doesn't happen here. I don't know why it doesn't
I know.
happen here. It just doesn't happen here. But then I had the other bad case that I had, I actually came and met with Barry Elliott was the CAO at the time. And I said, Barry, we've got to do something here. The community needs to. And Barry said, no, that's the last thing we want to do. Shut it down. And I was saying, can't we work together to bring this to the attention of the community? I was shut down. Barry said, no, we don't do that. It's going to make it worse, not better. So, you know, I've been trying on many fronts for a long time, but sometimes, you know, the support hasn't actually been there from council, from the staff. And it sounds to me there's been a change now.
Well, I think we've all been having those conversations with you, Charles, on just the severity of how it's going, and we need to change that. We need to get things done. When you post for lab and tech and for mental health, where do the postings go out from?
Northern Health.
Northern Health, okay. Because like personally, I've never seen any postings. I don't know.
No, they're not
How to
done
get the-
locally. They're
yeah,
done,
yeah.
They're done from Dawson Creek, I would imagine. Or, yeah, probably Dawson Creek.
So just a basic, it's just needed. There's no, that's where you got to work on, maybe just on the postings, and we can't really have anything to do with that. But we can.
No, but you can have a liaison with them that you're aware of whenever anything's posted, and then if you've got your ideas of how you're going to sweeten the target.
Right, yeah.
You know, you have to have that communication with them. It sounds like at the moment that doesn't happen. But,
No.
So what is your structure? I mean, you have a council person with a health portfolio, is that
Well,
correct?
I think, is that, Helen, is that
We
you
have
with the healthy communities?
Yes.
That's the healthy communities.
But it's not the same,
That's
that's
not
what I
the
was,
same thing as
see,
they
that's
had
what
in
I
the
was gonna
past.
see, like the task force that they want.
I
It's
brought
not the
back
s-
that, or mentioned that task force that Dave Price was on. See, I brought that back at the beginning, and I didn't have all the information, but that's something that needs to come back to light, because there was more bite on there. You know, you had the doctors on there, you had nurses on there, and you had Northern Health more involved. And I still in the health communities, we have a very hard time getting Northern Health involved in that. So I think that when it's a mayor's task force or whatever, there's more bite and more flavor from Northern Health to make sure, because there's doctors and nurses already part of it. So they're hearing right from doctors and nurses. So I think that's a big step. And I believe the district paid a coordinator, and that was Dave Price.
Yeah.
And I think that's something we need to look at.
There used also to be, and this is going a long way back, but there used just to be a councillor, because maybe you don't have portfolios anymore, but there used to be portfolios, and there used to be a health portfolio. So if there was any health issue, 10, 20 years ago, we wouldn't necessarily bug staff or the mayor. We would just go to that councillor and say, here's a problem. What do we do with this? How do we fix it? And
Portfolio thing is kind of falling apart, and we really don't have anything that takes its place yet. Something we gotta look at, I guess.
So I just,
But that-
So, like, I know, like, with nurses and stuff, we're attracting nurses, or Northern Health is, they have a sign-up bonus. Do they do that for lab and x-ray as well? Like, if they're bringing a nurse up, and I mean, I don't wanna mention nurses' names, because I don't think that's right, but I know certain individuals over there have gotten that signing bonus to come to the north. Do they do that with lab and?
I haven't heard of it happening, but I mean, I don't think there's any reason why it couldn't happen.
Then that'd be the same as council. I'm not sure if they do it there, but would you know, Rose, if there's that
They
signing?
don't, because that's all through Northern Health. My understanding is there's been several applications, people who have applied, and for whatever reasons, upon their final decisions, have chosen not to come. There was 4 for mental health, was what I was told. It's not, I mean, if everything was perfect, Tumblr's not for everybody. If you're not a great outdoor enthusiast, it's pretty different community, right? But I thought their needs were being met. We're going to be met with this last scenario, but it's perhaps more than they realized it was going to be, or something. I don't know. Very nice people, but it's just so it's quite overwhelming when you're used to working 9 to 5.
So these were people who were applying for the counselling positions
That have said no, yeah.
that have said no.
Yeah.
But again, so,
We don't
With
know
what
the
we-
whys.
but what
Maybe
we-
they had better
yeah.
offers.
but with what we're discussing here,
Yeah.
I mean, if we're saying what can we, so the next time this happens,
Do we have a proposal?
we have support from council,
Yeah.
meetings,
absolutely.
dinners, whatever.
Yeah.
These people are applying, it's not just, they're not just dealing with someone in Dawson Creek, they're
Correct.
actually dealing with the mayor and council of Tampa.
See, the traveling roadshow that came to town here last year or something, when we took them up to the falls and with the doctor, trainees, or,
Yes.
yeah, that one was really good, I thought.
Yeah.
They were pretty impressed with Tumbler Ridge. Nobody ever came to him back, but that type of thing with nurses, and I know Kate's daughter, she did the nursing thing down in Vancouver. When I talked to her, she didn't even know they were looking for nurses up here. So when you talk about those kind of forums that you attend and set up a booth and that, like Laurie did there, that's pretty important. When they got to know that you're looking for them, and there should be some kind of northern bonus of some kind. That'd be something to talk to Northern Health about. It's maybe something we could do something about here, but it should be something to look into. You had something else?
Yeah, thank you, Your Worship. I'm just wondering, like, social media, is there a way that we could actually, looking, Tumbler Ridge is looking to, build on its healthcare. These are reasons why you should look into coming and doing an infomercial, and then look for job postings in Northern Health and to just send them that way, but just to pique interest. I don't know, it seems to be the way people are going, but, or is that maybe,
You're right. One doesn't, I just need to be sure of my facts here, because I mean, again, I'm much more familiar with recruiting physicians than
Yeah.
anybody else, but I I mean, Northern Health has a recruiter
Yeah.
for physicians. I think they've got a recruiter for nurses as well. I think it's the same person. So, you know, what we're talking about here, I think is critical. This is just another, you're asking for concrete things, what do we
Yep,
do?
yep.
So this is a concrete thing, that Mayor and Council of Tumbler Ridge need to be in touch with the
Yep.
Northern Health recruiter for nurses and say,
Okay.
here are the problems, how do we help, whatever.
And bearing in mind, to come back around to the awareness of the group, the South Peace Health Board there that has been established, that is their mandate as well. So we're up against the region, and it was part of, like, I haven't had the questions answered yet. It was, in a way, I kind of felt like, I'm kind of in a conflict of interest here, because my priority is Tumbler Ridge, you know, so I don't know how that's gonna go, but it's the same thing, they got that pot. So perhaps a conversation with,
Are they nurses as well, or just?
all medical, nursing, doctors, everything, whatever is required for the South Peace, including Tumbler Ridge's needs, but again, if we have a sweeter pie to offer, you know, I don't know how that's going to work with this board.
I don't think we wanna take over something that Northern Health's supposed to be doing.
But we are doing that now, but we want to
Yeah.
enhance what they're doing and
Right.
how we can, I'd go directly to
Yeah, we have to
Northern Health.
personalize it to
Yeah.
our,
We do.
Councillor
Because
Strachan.
everybody's looking.
Well, I think we're heading in the right direction, like by talking here and then bringing, I think the big person to buy in and meet the right people would be Northern Health. Because on that Building Healthy Communities Committee, there's one person now from town that's a liaison, but as for phone-ins and stuff like that, like they're aware of the problems, but they don't make the trips to Tumbler Ridge, like the whole.
Is Deanna, did she take
No,
Kendra's position?
Now Barb is coming and sitting and
Oh,
she's,
right,
yes,
for local.
yes,
But,
for
but
local.
Northern Health doesn't attend
No,
them at all anymore, no.
No, and Kendra maybe made one phone-in, and
Yeah.
that was it. So, and then
And she
the
didn't
last.
make it to 5 meetings after
Yeah.
that. And she's had her own personal issues to
Yes,
contend with as
yes,
well, but
and that's everybody, I think, are hitting burnout, like,
yes, they
yeah.
do too.
like TR Cares is represented. I think we've got the last meeting, and happened to be there. It was
Excuse me.
really good because we were discussing the transportation issues and thinking of ways, what we can do right now and then build on it.
And if I can just add a little sidebar, because what I wanted to speak to on the TR Cares thing is us being very careful, because the alternative, if they did get the Northern Health bus to come through, would be 1 day a week. That would be it. And that's not what we want to have happen. The moment, like I say, you go to paying, we do pay an honorarium, because sometimes our drivers are gone 12 hours. We've had cancer patients we've taken in that should have gotten in at 10:30, not get in till 2:30, and our drivers not get home till 8 o'clock at night. Never mind the wear and tear on that patient that has is already battling terminal cancer. They've now spent 12 hours on the road for a 3-hour treatment. So we are trying to offer some solutions
excuse me.
to the best we can do. Because
Yeah, I thi-
alternatives were done, and that's not a good solution.
I think you brought up something that's very important, and that's a place to stay when they go to Dawson Creek or Fort St. John. That society that's just getting started up, that's the type of thing that's supposed to work on. They're supposed to have and they were surprised when I said, well, we already got condos and stuff for that. And they're supposed to get that all listed and so that everybody can use it.
That's correct, and I looked at that, Don, and my understanding is that's down the road, and we need it now.
Yeah.
So I've already had conversations with several hotels. It's funding, and if things go right, it might actually be doable. And while, like, the Ronald McDonald House and the lodges and things like that are good, they come with big money tags. Our interim solution is not that expensive. We're looking at like $1,200 a month to guaranteed a secure place, because there is no hotels right now. I found 2 homes that people can stay at for $20 a night just to cover the cost of their meal. So those kinds of things are amazing.
again, Rose, if we're looking for, you make miracles happen all the time, we know that. But just before I left, I was actually, again, we're looking for concrete things. I mean, the main concrete thing is the meeting with Northern Health and the MLA.
Yes.
That's good. But just before I left, I actually, along the same lines as what Rose is saying now, concrete things that can make a difference. So if we're sending a cancer patient to Prince George, we say, okay, here are all the places you can stay that give you huge reduction. Here is the lodge. Here's where you can get your pills. All these things. This is what Prince George as a community somehow has managed to do, recognizing you're very sick, and this is the break that you get because you need help. You send someone to Dawson Creek, there's nothing that you can do. So Dawson Creek now, and sometimes things just take time to catch up, but one of the really good things that Dawson Creek is doing is a chemotherapy program, so that the cancer patients actually don't have to go to Prince George, or it used to be Grand Prairie or Edmonton even, for their cancer treatments. They can go to Dawson Creek. But do you know how hard it is, if you're getting your chemo, to have to drive in winter 2 hours each way in a day and then go back the next day because you can't afford it? It's just a nightmare. So I started speaking to Dawson Creek about the need, and I even spoke to the doc that's running the chemo program and said, wouldn't this be a good idea? I said, wow, that would be a great idea. But he's so busy. It's not his job to be creating a lodge, but it's almost more of a political thing. So
Yeah, I think it is.
the pressure needs to be, because the thing is, if you're this committee in Dawson Creek, the South Peace Committee, and you're living in Dawson Creek, you haven't got a problem with this. It has to be Chetwynd and Tumbler Ridge that put the pressure on Dawson Creek to say, you're a referral for chemotherapy, you need to create a lodge or work on your hotels to offer a deal or whatever. So to me, it's more of a political battle than anything else. So to me, this is something that you could get involved in.
Yeah, Mayor Bumstead has no problem asking for help and stuff that he would need, so they'll go back to him and say, this is something we should be looking at.
Yeah.
I have no problem doing that.
Well, this would be a definite ask with that committee, and this is where that committee, rather than being in conflict and competition, this is where we do need to work together.
The committee or society, whatever you want to call it.
Yes.
Yeah, but it also political.
Yes.
I think
Individually.
it's also if you're able to arrange that meeting with Northern Health and the MLA, which I think we all agree that's the place to start.
Yeah.
And this would be, you've got to go with concrete things. You can't just go and whine. You have to say, here are the solutions. Give the people the solutions on a plate. Well, here's a solution. It's one part of the puzzle, but it's an important part.
And it's a precarious one trying to balance, because at the same time, we also don't want to undertake too much of the provincial obligation,
Yeah.
because there's nothing more permanent than temporary.
Yeah.
Exactly, that's kind of what I was
Yes.
trying to say there. You don't want to take something because they'll give it to you right now.
100%, yeah.
I actually have a 10 o'clock meeting. I didn't know it was going to be.
Okay.
Okay.
I think we've got to where we can start. And that'll be early in the new year. We'll try and get that meeting. So, yeah. Thank you very much for your.
Thank you.
Yep. I'm gonna give you a call on a totally different item, if you're around later today.
Now I can even sit down and talk to you if you want.
Okay, just give me 2 minutes.
Okay. Okay, I guess,
On the upside, a quick note, we did 31 toy hampers and seniors yesterday.
Nice.
Oh,
Plus
good.
all of the food banks.
That's
Nice.
awesome.
Yeah, that was a good day.
So-
See you guys, thank you so much.
Yep.
Can we find out who the Northern Health recruiter is? And,
Yeah.
yeah,
you find that out, eh?
yeah, because I think that would be a huge start, especially for the lab techs and nursing staff.
Yeah, so we want Northern Health at this meeting. We want Mike, the recruiter, the head of the nursing. I'm going to a nursing thing on Saturday, on Wednesday, a meeting in Dawson Creek. So maybe have some more names by the time I get back from there.
Excellent.
Well, and when there's people applying for jobs in Tumbler Ridge, that would be nice to know too, so a person can try to reach out to them and get them some reasons why they should choose
Okay.
us.
Also, looks like they're looking to reinstate the mayor's task force on health or senior needs. Maybe
Yeah.
that's
Yeah,
something
I
else
see
we
what
better
that-
bring back.
Yeah.
Because the healthy communities doesn't seem to be the one
Wasn't-
that,
Wasn't it that one though, that Ellen Sager and you, like,
Yeah.
there was that health committee or whatever?
Oh,
And
we
they,
tried to get that going and nobody seemed to be
I think that's
excited
good.
about doing it.
I think that's be a budget put forward. Like, I know they hired a coordinator. I mean, at that point, that coordinator was Dave Price,
okay,
right?
Was he? Oh, yeah.
He was hired through the district,
That's
right?
right, yeah.
It was, well, I mean, obviously, it was published and put out there for that. He applied and got the position. That's who I went to when I first joined council. It's a huge gap that came off when
okay,
the previous council was in and decided, whether it was the mayor as a whole,
Yeah.
decided to move that on and stop doing it. And that's why when I came, that's why I started, and that's who I talked to was Dave.
okay.
Because he has a lot of the knowledge of it. That's why we have the ramps are painted in yellow, and we have this and we have that. It was all because of that task force.
A lot of things
You
happen.
know, coming up with a bylaw to allow you to extend your front doorway so you can get a wheelchair into there and stuff like that. That's all come from that task force.
Yeah, I forgot he was a paid.
He was paid. Yeah. I'm not sure what that budget was set at, but
How long was
there was a
he?
contract. He did it for, I think, 4 or 5 years, Dave did.
Oh,
It
okay.
was fairly big. And then Dr. Helm was right. There became a friction somewhere, and
Is it, can we get that brought back so that we can get at the budget? That position.
motion to adjourn special meeting?
Second.